Call the meeting to order. It's 12:32. So the record will reflect that District Attorney Powell is participating by speakerphone. So I'll ask Mr. Notarianni to lead us with the Pledge of Allegiance.
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Welcome to Commissioner Shermack. This is your first official prison board meeting. Welcome. Well, we try and keep the fire out of these meetings if we can. But welcome, and we hope you enjoy your time here as opposed to doing time at the prison. So we'll call them, and I'll ask for a motion. I assume everybody's had the opportunity to review the minutes that Tracy sent us.
So moved.
And so we'll ask for a motion to approve the minutes.
Second.
And a second on the question. All in favor?
Aye.
Any opposed? Okay. I believe we have to reorganize. So, which would mean that we'll need to select a new chair and vice chair of the board. So, pardon? You want to have a public comment? Okay. All right, so we'll have, I'm sorry, yeah. Let's have, anybody wish to, in the public, wish to address the board on agenda items only?
Okay, motion.
All right. So, nobody stepping forward. So now we'll have a motion to appoint a chairman and a vice chair of the board.
I would like to appoint Judge Gibbons as the chairman again.
I'll second that motion.
All in favor?
Aye.
Any opposed? Okay, just ask, what do you people have against me? Okay.
Nothing personal.
All right, on the question, and so the ayes have it, I will be chairman for this year. And likewise, we need to choose a vice chair.
I'll make a motion to reappoint Sheriff McAndrew as vice chairman.
I'll second that.
On the question, all in favor?
Aye.
Aye. Any opposed? Okay, the ayes have it. Congratulations,
Congratulations to you.
Sheriff. You and I will go down together again for another year.
Yeah.
So next motion on the agenda is a motion to set the regularly scheduled meeting days for the prison board to be held on the third Wednesday of the month at 12:30. Meeting generally in the Commissioners' Conference Room, but quarterly at the Lackawanna County Prison unless otherwise specified. Do I have that motion?
So moved.
Second.
On the question? All in favor?
Aye.
Any opposed? The ayes have it. So our motions, our meetings will be regularly scheduled meeting days on the third Wednesday of each month. Generally, I believe we follow the commissioners' meetings.
Normally at 12:30.
And as long as,
Meetings are at 10 o'clock.
right,
They seem to be going along a little more quickly,
okay,
so we shouldn't be late.
okay, all right. Okay, and next motion will be on the agenda is a motion to follow Robert's Rules of Order. Do I have such a motion?
I'll make that motion.
Do I have a second?
I'll second.
On the question, all in favor?
Aye.
Any opposed? The ayes have it, so we will continue to follow Robert's Rules of Order for conducting all of our meetings. All right, so now we'll get into the next item on the agenda, which is a motion to approve all current payables for the Community Corrections Center as well as the prison. They were sent out with Tracy. I hope everybody's had the opportunity to review those, and assuming that you have, I'll entertain a motion to approve those current payables.
So moved.
Do I have a second? We have a second. On the question? All in favor? Aye. Any opposed? Okay, the ayes have it, and the record will reflect that Commissioner Dominic has joined us. Welcome.
I apologize, I was in a meeting trying to get something done for Judge Price.
No problem. Welcome
Thank
to your first prison board
I know, I'm
meeting.
excited.
Okay. Well, don't peak too early. All right, so we're down the motion list. We've appointed a chair and vice chair,
Okay.
myself, and Sheriff McAndrew again, otherwise known as the usual suspects. We've taken care of the second motion to set the meetings and to follow Robert's Rules of Order and to approve all current payables. So now we're item 20, 2006, motion to pre-approve and audit bills and certify for payment all bills which routinely fall within the adopted budget, and that all invoices which do not fall within the adopted budget parameters be brought here to the board meeting for pre-approval for payment and to approve payroll at the monthly meetings. Do I have such a motion?
I'll make a motion.
Commissioner Shermack, do I have a second?
Second.
Second by Commissioner Notarianni. On the question. All in favor?
Aye.
Any opposed? The ayes have it. That motion is approved. Commissioner Dominic, forgot to tell you, District Attorney Powell is on the speakerphone, so he's here. All right?
Okay.
Okay. So we'll move to our reports. Can the Community Corrections Center report?
Good afternoon, Board.
Good afternoon, Mr. Jeffers.
How are you, Your Honor? And the Community Corrections Report for December 2019. This is actually the final report for the year of 2019 also, so all the totals on here are the final totals for the year. Item 1, our program had male work release had 40 participants in the month of December. Female work release had 4 participants. Adult house arrest had 125 participants, and juvenile house arrest had 18 participants. Our program's revenues for the month of December total $64,216.87. Our year-to-date totaled $734,401.78. Our program's expenses for the month of December totaled $125,714.75. Our program's completions, work release had 13, house arrest had 30. Our program violations, work release had 4, house arrest had 4. Our program's warrants, that should be reduced to number 6 for work release. Someone just got caught recently. And house arrest has 3. Our final budget report, our overtime was at 138% for the year. Our expenses were at 102% for the year, and revenue was at 96% for the year. For the new members of the board, the overtime expense was due to a lack of an officer for about approximately 7 months until we hired one. Until that time, that's where the overtime got gobbled up from. We hired in July, and she started in late July. She got trained, and she started in August, and our overtime dropped dramatically. That concludes my report.
Okay, I noticed on the written report, you indicate it's November, but I assume
Yeah,
that's
it's
a
December.
typo.
That's a
Okay.
typo.
All right.
Sorry
just,
about that.
We're clear. No, that's all right. Just want to make sure. Any questions for Mr. Jeffers? If not, I'll entertain a motion to approve his report.
So moved.
Do I have a second?
Second.
On the question? All in favor?
Aye.
Any opposed? Okay, the ayes have it. Thank you, Mr. Jeffers.
Thank you, Board.
Thank you.
Report is approved, and we'll move to the next item, the Warden's Report. Warden Betty, please.
Good afternoon, Board.
Good afternoon.
The in-house population, the average daily population for December 2019 was 697 inmates, 530 were county inmates. As of January 10th, we had 676 inmates, 572 of them were adult males, we had 1 juvenile male, and 103 adult females. The population of U.S. Marshal Service detainees as of 1/10 was 168 individuals. The overtime, out-of-county boarding, and community service reports are attached. The staffing update, currently our correctional officer numbers break down to 173 full-time officers on shift, 10 part-time officers. We have 1 out on workers' comp, 4 on administrative leave, and there are 3 part-time vacancies. The totals are 178 full-time officers and 10 part-time officers. FMLA, 42 officers have intermittent FMLA, amounting to 24% of the COs. Budget, as of December 31st, revenue was at 105% and expenses were at 101%. The major contributing factor to going over on the budget on the expense side was the line item for medical. It was significantly over budget, about 25% over budget, or $400,000 on this line item. Inmates at or past their minimum dates, 25. 14 have submitted home plans and are awaiting parole. 3 have no home plans. 2 have had parole denied due to unacceptable home plans or misconducts, and 6 have been remanded for the balance of their sentences. Extraordinary occurrence reports, there were 7 since the last prison board meeting. On January 1st, a county inmate was placed in a restraint chair due to being uncooperative upon commitment. On January 2nd, a county inmate refused to return to his cell, refused to be cuffed, and refused to cooperate with staff orders. Additionally, this inmate was in possession of an ink pen that he was threatening staff to stab staff with. Staff used the pepper ball gun to administer OC, extracted the inmate from the cell, and placed him in the emergency restraint chair for his safety as well as that of the safety of the staff. On January 3rd, a county inmate was found non-responsive in his cell. Medical and corrections staff performed life-sustaining techniques until the ambulance arrived. The ambulance crew declared him deceased at the prison. He was taken to the hospital, where he was pronounced dead by the ER doctor. The death was later ruled a suicide by the county coroner. On January 3rd, also on January 3rd, a new county commitment was aggressive and uncooperative upon commitment. She was placed in a restraint chair for staff and inmate safety. On January 6th, a new county commitment was making threats of harm towards staff and also stating that he was suicidal. He was placed in the restraint chair for everyone's safety. On January 7th, county inmate was placed in the restraint chair for his own safety after expressing suicidal ideations. And on January 9th, a county inmate was acting bizarrely and not complying with staff commands. He was placed in the restraint chair after being resistant. PREA, there were no PREA investigations completed in the month of December. And this concludes my report.
Thank you, Warden. Anybody have any questions for the Warden?
With regard to the budget, so it was over budget.
Oh, I'm sorry. Thank you.
With regard to the budget issue, you indicate that it was as a result of medical. Can you be more specific?
Yeah, we had budgeted, I don't have the exact numbers, but say we had budgeted $2.5 million for medical expenses. The medical expenses at the end of the year tallied to $2.9 million. It was
Okay.
$400,000 over budget.
And can you provide me with documentation with regard to the expenses that caused the over budget?
I would have to point you to our revenue and finance. They get the bills directly sent to them. I don't get the bills.
Okay.
Does that, I'm just thinking, I don't mean to interrupt you, but does that include when an inmate is taken to an outside medical facility?
Yes.
And then with regard to the 14 people that are awaiting home plans and are awaiting parole, do you have any idea as to how long they've been waiting or what the delay is, or?
Sometimes the delay is just a lack of an ability to find an acceptable home plan by parole standards. Other times it's a family issue, family and friends, or lack thereof. There's a variety of issues, but what we do is we meet, I believe it's weekly, it might be bi-weekly. Some of my staff and some of probation and parole, they all get together. They discuss these cases in particular and try to come up with a resolution.
Okay. I just know from my prior experience that sometimes, like for the 14 that says have submitted home plans and are awaiting parole, is there a policy in place to get them out within a certain time period?
Not that I'm aware of, but once they submit that, it's then up to the parole department to get out and check out that home plan and make a determination as to whether or not that home plan is acceptable.
Okay, have you experienced any delays in regard to that?
Well, again, sometimes in having never seen the conditions of the home plans of some of these individuals, yeah, there are delays in that, and a lot of times I suspect it's directly related to unacceptable conditions, whether it's the individual's family won't get rid of the guns, or the conditions just are not conducive to proper rehabilitation.
Do you have any specifics, or could you provide me specifics with regard to the 14 people that remain?
I can get that,
Can you please do so?
absolutely.
And then finally, you indicate on administrative leave that there's 4 people. What, I thought when I had met with you, there was a total of 7.
Yeah, I'm only reporting on correctional officers there.
Okay, you're not reporting on the higher-ups, the captains or the...
Correct.
Okay, so that would not include the 3 other people that we discussed?
Correct.
Okay. That's it.
Anybody else?
I have a question for the warden. Warden, regarding the suicide, can you talk about how our prison tries to avoid suicides from occurring? And
Sure.
was anything out of the ordinary in this particular case?
Yeah, well, the way we go about trying to avoid it, our suicide precautions are that we ask the individual at multiple times about suicidal ideation. We also take into account anything we hear from family or friends on the outside, or individuals that are housed on the same block with them. Sometimes they'll also come forward with information if somebody's feeling out of sorts or significantly depressed. But we have specific questions that we ask. In particular, coming in the door, there are 5 very specific questions that we ask, as well as asking the agency that's bringing them to us if there was any concerns about suicidal ideations. Once we've determined that there's a possibility that this person may be suicidal, we have precautions to take place where we could put them on a 30-minute watch, a 15-minute watch, in a camera cell, one-on-one watch where an officer sits outside the person's door and stares at him if things are that significant. We have that restraint chair that I mention all the time in my report. That's a suicide precaution as well as other things. So there are various things. We also have a psychiatrist. We have our staff gets annual training. You get training when you're first hired, but you get annual training in suicide identification and prevention as well.
Who gets annual training?
Everybody gets annual training.
And Dr. Malik is the physician that you're referring to?
He is the psychiatrist that's subcontracted by our medical health care provider,
He's
which is
there at a max of 9 hours a week. Is that accurate?
that. Yeah.
Was this inmate under watch?
No, this inmate had just been moved into a housing unit pending an investigation.
I think we, Gary, I think we should not talk about anything that's
Okay.
specific lawsuits,
That's not a problem.
actually. Okay.
So you're going to adjust policy, just not this particular case with specific.
Completely understandable.
Warden, that $400,000 over budget medical, was that an array of issues, or was it one certain one, or was it just an array of things that caused that to?
I honestly can't answer that question. I don't know. I don't see the bills.
Okay.
The bills are submitted to the County Revenue and Finance Department. I don't see them.
I'm going to obtain a copy of the bills from Mr. Durkin. The bills that he doesn't see them. We had this discussion as well. They are sent directly to Tom Durkin. So I will obtain those and see what the issue is with regard to that.
Anybody else? Okay, if not, I'll entertain a motion to approve the Warden's Report. We have a second?
Second it.
The second on the question? All in favor?
Aye.
Any opposed? Thank you, Warden.
Thank you.
Appreciate it. Don't sit down. It was nice of me to wait until you just got back to your chair.
Good exercise.
Next, the new business on the agenda is a motion to review and approve the proposed inmate tablet policy. warden submitted a draft along with that, and it was added to the agenda. Everybody have an opportunity to review that?
My office had a few questions or concerns that,
Okay.
that perhaps we can discuss with the warden outside of the meeting, if this can be held off until the next meeting, Your Honor, so that we can go over our questions with him.
One thing I would like to say is that Wayne County has implemented these, and I do have somebody actually working on it, and that's why I'm looking at my phone, because I know one of the issues was, or when speaking with Judge Brace, the primary issue with him and speaking with Mark is how do you know that the person who checks out the tablet keeps the tablet? So I have some information. I just did not have, because I was in that meeting, have an opportunity to speak to the person that I have working on it. But there are certain security measures in place, such as face recognition, things of that matter. I'm also trying to find specifically how much revenue it'll generate, but my understanding is it could be a significant amount for the prison. I think that he said GTL generates somewhere, just for the phone system itself, somewhere around $45,000 a month, right? Mr. Petty?
$40,000 to $45,000 for us.
Right, so that's, if we use that, the devices themselves, is my understanding, Mr. Betty indicated between two companies can get them for free and have actually enough, if not more, than the inmates that are actually there. And some of the information that I was getting is that, like, for example, LexisNexis can be loaded on them, which would save the county $670 a month. So there are certain savings involved with regard to those tablets.
Yes.
And there are security measures, so I have no issue with tabling it. But if anybody here has specific issues that they want answered, if you can let me know what they are.
Perhaps my Chief Internal Auditor, Reggie Mariani, might be able to ask a couple questions right now, if you'd go to the podium,
Sorry.
Reggie, and get them resolved.
Excuse my voice, I was operated on yesterday, so. Who will actually own the tablets, Tim?
GTL, the phone company.
Okay, and when the contract expires with GTL, are the tablets going to be ours, or do they take them back?
That's a good question. I don't have the answer to that.
Are there any tablets available for the hearing-impaired?
Not that I'm aware. There's something called a TTY machine that we use for telephones. I don't know if that's transferable. I do know that they can also be used for email and text as well.
Okay. What happens if, say, an inmate buys a movie and the battery goes dead on that particular tablet? Does he not be able to watch the end of the movie?
Yes.
He does.
Yes, there's charging stations on every housing unit. It would be his responsibility to make sure he had a fully charged tablet.
So is there going to be enough tablets for every inmate?
No, and that's by design. We have certain areas that we would not have tablets in, like our disciplinary custody area, places where we have those individuals on suicide watch, and newly committed inmates that are in assessment units.
If there's not enough tablets available, what criteria is going to be used to determine what inmate gets the tablets?
Well, I was doing some figuring yesterday, and if this got employed right now, we'd have 350 tablets. Our population of 680 or so individuals. There was 142 that fell into categories that wouldn't be in housing units that would get tablets. There are individuals who aren't going to want to spend money. There are individuals who aren't going to trust modern technology out of some type of paranoia, in all honesty. Basically, it came down to, I was calculating out one tablet for every 1.6 inmates. There would be specific times that they could use those tablets, and they would have to share those tablets. We're not going to have one for one. And if it became an issue, GTL has already said, if you guys need more tablets, we'll supply them. But based on their experience, they usually find a 6-to-1 ratio is more than efficient. Our ratio would be less than a 2-to-1.
Who's responsible for replacing the damaged tablets?
If there's damage to a tablet, the inmate would be responsible for that.
What if it's damaged or used?
We would know because of the facial recognition who was using it.
Did we get any paperwork to show how the audit, so we can audit it to see the charges to the inmate versus the charges that we get to GTL?
I have not received anything like that from GTL, no.
Can they give us a sample, maybe?
I'm sure they can. I can ask. I know that my main contact he's at a conference until next week, so I wouldn't be able to get answers till next week.
Okay. The policy you have is 2 pages, and I think someone mentioned that to look at the state policies. Have you had a chance to look at the state policy?
I don't think the state had anything. I was searching to find something. They have something about electronic equipment, but I don't think it spoke directly to tablets. What we got that, and I'm not sure which county we got that from, but we just took a look at that, and as policy and procedure, it's a living, breathing article that we could amend it to make it stricter or looser over the course of time at any time we wanted to.
Yeah.
So it was kind of just a starting point. Let's get these in there. Let's see how things work out. What do we have to change?
Yeah. So it's a work in progress.
Yes. And all policy and procedure, they're works in progress.
Yeah, like New York State has a policy, I think it's 13 pages long. So I give you that if you want it. There's another county that has a policy that's 11 pages long.
And sometimes, Reggie, in all honesty, sometimes you can go too far with policy and overkill. If you address every single situation, my policy and procedure manual will be 3 feet thick.
And I did review this prior to today, and I thought it was a very thorough policy. I think we got it from Wayne County,
I think that is Wayne County, yes, ma'am.
but I'd love to look at those policies.
Okay.
Some of the other things, just for the board,
Thank you.
they said that Smart Communications is who they use, I guess. With video visiting through face recognition, if anything inappropriate occurs between the inmate and their family, there's like a built-in mechanism where it's identified and it shuts right down. Law library can be preloaded. Inmates can order commissary. Like I said, they would be able to get Nexus Lexus downloaded. It would save $670 a month, the county on that. It also indicated, which I thought was a good security thing, is we're always worried about drugs coming in through the mail. They actually, what they do is they have, all the mails now, they have it sent to Florida. What they do with the state, well, with the county, with Wayne County, they have all the mail sent there. It's scanned and then uploaded. So the inmates read their mail on the tablets, which then eliminates, number one, the need to have a correctional officer go through all the mail, or at least a good chunk of it, but also on top of that eliminates the possibility of mail, of drugs being taken in via mail. So if there are any other concerns, I would like, if somebody can just let me know if anybody else has any other concerns, so I can try to get some of these questions answered for the next board meeting. Because I do think it can generate, they are in the process of trying to gather information with regard to the specific amount of money that it would generate, but the prison needs funds to try to get some things done. So if I can answer the questions and try to get these approved, I'd like to do so for purposes of the revenue.
Thank you.
Thanks, Warden, for answering our
Thank you.
Not a problem.
questions.
Warden, would these be available to the federal detainees?
Yes, sir.
Okay.
Yeah, and I shouldn't be remiss and just let it go, but Commissioner Dominic had mentioned Smart Communications. It's a second company. We had been in contact with Smart Communications for providing inmate mail service. And that was our intent all along. I stopped moving forward with it because of the questions that you folks had about the tablets, because Smart Communications mail system relies heavily on tablets as well. If you took that into account, if Smart Communications were allowed in, we would have more tablets than inmates between the two different companies, GTL with the phone system, Smart Communication. And Commissioner Dominic's 100% correct. They would preload LexisNexis. We have right now 4 contracts with LexisNexis for what they call external hard drives to load onto computers. So we're actually spending 4 times that amount that Commissioner Dominic meant for those 4 computers. This would be, everybody would have the full law library right on every tablet that they picked up.
So that's around, I'm terrible with math, but 7 times 4, $2,800 a month then we
Yeah.
would save.
Warden, I am not computer savvy. I'm the first one to tell you that. What is LexisNexis?
That's the law library.
Is that all that is?
Yeah,
Sorry?
The legal research.
Okay.
yeah.
So that's 28, what did I say, how much did I say? $2,800 a month we would save, because it would be downloaded on the,
It'll be downloaded right onto the
I
tablet?
assume you
Yes.
could dedicate a pad for the law library outside of what's issued to the individual inmates, if you had inmates that needed
good
to do
idea.
legal research but weren't entitled to a pad.
Absolutely, and yes, because right now what we do is we give them special time in our law library. You go into our law library and it's just a couple computers that have LexisNexis preloaded on it. That's all it is, and it's hooked up to a printer. So we're already doing that, but with these tablets, it would just be, okay, tablets aren't allowed in Delta Housing Unit, and we have an individual down there who's representing himself and wants to be able to do legal research. Right now, we bring a whole kiosk like this with a computer inside of it to him. We wheel it to him. This way, we'd be able to say, here you go.
and can you just touch upon what they would be able to access from the tablets? There are limitations, and is there, is there a digital footprint, more or less?
Yes, there is, and there are definite limitations. We set those limitations. Number one, we'll be able to set it so every tablet won't work outside of its housing unit, its particular housing unit. It would be set up as an intranet, not an internet, so that the only thing you'd be able to download is what we allowed to be downloaded, because we'd have to upload it first. So if we decided we didn't want to allow any movies with Jim Carrey in it, I don't like Jim Carrey, just so everybody knows. We can ban that, so that nobody can access Jim Carrey type movies. And if Mr. Carrey's watching this, I apologize. But we have total control over that. Same goes for music. We would decide what music was uploaded to our intranet that they could then download to their tablet, so that there are some very controversial music and videos out there. They're not going to get them.
Good to know this has been thoroughly reviewed, and we're bringing our prison.
And the thing is, our Department of Corrections has done all the research basically for us. They have it implemented throughout the entire state system.
I think we should possibly, when they called Wayne County, because they just started using them, they don't really have the full data with regard to how much it can generate. So maybe you can call one of the state prisons that utilize it and just try to get some sort of gauge as to how much money it would generate for the prison.
I can reach out to SEI Waymart.
That would be wonderful. And I just would like to have it put back on the agenda for next month, and hopefully we'll have more information.
So you want to table the motion?
I'm assuming, based upon the conversations and the questions, not everybody's ready to approve them as of yet.
In light of all this information, I won't have an issue.
Is anybody willing to move forward with them, or do you want additional information as well?
Well, the motion is to approve it, so if you want to table the motion,
I mean, I'd like to move to approve it, but
I'm fine with that.
Mr. Powell, you...
I prefer to table it as well,
can I ask what your
the next meeting.
concern is? Because, I mean, it will generate a substantial revenue and decrease some expenses, and the prison needs a lot of things in terms of medical and security, and as we just learned, are over budget by $400,000. So what is your concern?
There are some unanswered questions that were generated today. My primary concern is security. I know that the warden had reached out to my detectives and other law enforcement agencies, although I have not been updated with that. And I'm not opposed to having them available to the inmates. I just want to make sure that the policy in place when we do it is the correct policy. And I think at this stage, waiting a month is, with the amount of questions that were generated just today, is a reasonable request.
Could you possibly provide me, this is Debbie, can you possibly provide me with a list of specific concerns that you have so we can try to have them addressed? or have your detectives call me, or however we need to do it so that we can resolve it, because I do believe this was listed back in September, so it's now how many months, and it's still sitting, and I want to get them approved if possible, sooner rather than later, because I'm working with the warden on the issue. Like, I know security issues,
Once I
but
get updated from the detectives, I'd be glad to raise any security concerns that they have and provide that to you.
perfect. Yeah, just like, what specific security issues is what I'm asking, or what specific
Understand.
security concerns? Thank you. Okay, so I'll then that's fine. I'll move to table it for 1 month until the next meeting.
Okay. Do I have a second on that motion? There's a second. On the question? All in favor?
Aye.
Any opposed?
I'm done now?
Okay, we're tabled till next month. Thank you, Warden. Okay, anybody from the public wish to address the board?
Hi, my name is Beth Ann Zero. I'm a resident of Dunmore and a business owner in Dunmore, also co-founder of a local group called NEPA Prison Advocates. I'm really hopeful after the discussion that we've had so far today. I'm kind of here to plant a seed, and a big portion of that is something that we've discussed already today, and that is the mental health care and the physical health care of the inmates at our prison. The seed I'm hoping to plant is to maybe transform our prison from just a jail, as we've heard it is over and over again in the past, to a wellness and rehabilitation facility. This would benefit both the residents and the staff. We'd become a benchmark for both community outreach and for fiscal responsibility. By utilizing our local resources, we have 3 hospitals, we have a medical school, we have 2 universities and a college, all within a mile of our jail. And it would be important for us to bond together as a community and start to make changes within the prison. The first step's already been taken. The University of Scranton, funded by a grant from the Vera Institute of Justice, is already undertaking a data gathering project in conjunction with the prison to give us a better understanding of who is in our jail. And this is going to help us understand how we can best treat and or educate not just the residents, but also the staff who is there at the front line, who has to deal with the people who are dealing with major events in their life, people who are dealing with addiction. Our staff deserves a healthy and safe work environment. All conversations leading up to now have mentioned mental health and addiction. So mental health and addiction are the key things that we need to address. Yes, this is also a place where we incarcerate true criminals, but we have so many people there who need help. So this attests to the importance of the medical care that's provided. There's never really been emphasis in the past placed when we were preparing to choose a mental care contract. Last time, a year and a half ago, it got rushed. There was a very small, short RFP compared to some of the other contracts from the prison. It was all decided within a 2-month period, where the commissary took, I think, 6 or 8 months before it was finally approved. So it's not too early to start looking forward now. We have a year and a half, so we have time to make a better plan this time. And it's not too late to ensure the current provider is fulfilling their contract. It was noted in their contract that they obtain an NCCHC certification. Well, it said accreditation, where it's actually the prison itself that would gain accreditation, and the medical provider would get certification. We can't confirm that he has certification, but you can. So NCCHC is the National Commission on Correctional Health Care. That was a requirement of the RFP, but that's something that the facility itself would seek for. So the provider can be certified, and the contract verbiage is very important as we're moving forward. So our suggestion is that the board even considers seeking NCCHC facility accreditation. It would provide guidelines for system improvements and oversight. Oversight is one of the key things that we've been looking for in the past.
You said HCC, can you?
NCCHC, National Commission on Correctional Health Care. What they do is they provide the service for a fee, but even a $10,000 fee would provide us with preventive care. And it'd be better spent than possible legal fees for any lawsuits that could arise. It's a possible life changer for those who are affected by poor care while they're here. We understand as a new board, you've got a lot to learn about the county and the operation of the county in general, and a lot of those responsibilities could be overwhelming. And I don't stand here as an expert on healthcare. I don't stand here as an expert on prison reform, just somebody who truly cares, who sees that there's great possibilities out there if we look for the right resources. The Vera Institute of Justice, they are always willing to sit with us and help us understand where we can make improvements. Just like the NCCHC, they are there to come in and take a look at the policies and procedures and make sure that everything's being done to basically ensure that the prison itself is going to be shielded from possible issues down the road. So that's just my seed that I want to offer. I think.
If I may say, there is, at the University of Scranton, the Criminal Justice Center, they have a Center for the Analysis and Prevention of Crime. I actually have a meeting coming up with them. I am going to have like a task force. The prison is a primary goal of mine, particularly the medical. So I am in the process of potentially looking at an RFP and putting one together with our solicitors. And also, I met with Judge Brace, and that's why I was late today. I met with him twice so far, and we have a plan to address the ongoing need for drug addiction treatment in the prison, drug addiction treatment for people when they're out of the prison, making it equally accessible for people who do have the resources and don't have the resources to pay for it.
Right.
Also the mental health component of it, which is tied into addiction, but also individuals, people with just mental health issues, but maybe not drug addiction. So he and I do have a plan that we are implementing in stages. And it is starting with me meeting with this facility at the University of Scranton. But the concern of mine is the same as yours. And with regard to the current medical care that's there, I do intend on meeting with Dr. Zaluga relatively soon to ensure that my concerns are addressed in the meantime.
I appreciate that. It's really encouraging.
It is on my radar, and it's actually one of my top priorities.
It's very encouraging. Thank you. And that's all I have for today. So thank you.
Anybody have any questions for Ms. Zera?
Oh, I do have one other question. I did not hear the report on the account balances for commissary, inmate fund, and the CDs.
There's been a staffing issue at the prison, so we didn't have a controller's report.
Okay.
We'll have it next month.
All right, thank you.
And it'll be comprehensive.
That's right.
Anybody else? Doctor?
I'm Dr. Stephanie Bressler, and I live in Scranton. I certainly welcome our new commissioners, Commissioner Dominic and Commissioner Chermak, to the prison board. During their campaigns, you both expressed an interest in seeing positive change at the Lackawanna County Prison, and certainly I'm encouraged by what I'm hearing today. I began attending prison board meetings in December of 2016, as did many members of the public, some of whom are here today, following media accounts of allegations of sexual abuse of female inmates. Many of us continued to attend meetings and advocated for changes at the prison. Some of these changes have been implemented. including the reestablishment of the GED program, better pay for in-house jobs available for women inmates, improved meals, including better nutrition, and finally, milk and calcium products for female inmates. And as you'll hear more about today, the development of a book program. Post-election, Commissioner Dominic proposed the idea of criminal justice reform, which we've heard about again today, that would include not just the prison, but many of the underlying elements, such as the cash bail system. As you know, many of the current inmates at the prison are pretrial detainees who cannot meet those cash bail requirements. So we certainly welcome any look at that system. Commissioner Dominic said, and she repeated again today, that she plans to create a task force of academics in relevant fields, mental health professionals, addiction treatment providers, and others with expertise in corrections who could recommend local criminal justice reforms to reduce recidivism. I hope you will consider adding community advocates and people who have served time in the Lackawanna County Prison to this task force. They have important input to provide. I encourage Commissioner Dominic to follow through with this plan and ask her fellow commissioners and members of the prison board to fully support this effort. Do you have any questions for me? I'm usually asking the questions.
I would just like to say that bail reform is also on my list of to-dos. But one of the things that Judge Brace and I discussed was the fact of trying to get some of these people, as opposed to keeping them incarcerated, but moving them out of there and either putting them in, we have a pretrial services program, which is like probation pending the outcome of their case, so that we can keep them on the right path and get them the resources that they need for their treatment. There's also, we're talking about a daily reporting system. We're trying to get more treatment and revamp the programs that are actually available inside the prison, so that people with the disease of addiction actually get some form of treatment in terms of AA or groups or something. So we are looking at all of that.
Good. Thank you.
Thank you, Doctor. Anybody else? Joan?
Joan Hodawanitz, 101 Penn Avenue, Scranton. Well, I'm back. And I'm going to start with something really dry, and that's the 2020 budget, which is being reopened. I took a look at the budget which was approved in November, and the changes from the 2019 budget to 2020. And as you are well aware, the prison is a large chunk of the county's general fund budget. And what surprised me was normally when you see the line items on salary and wages, it goes only one way, it goes up. But in the case of the prison, it went down $50,000. So Warden Betty, do you know what that $50,000 reduction is? You might want to take a look at that, okay? And the reason I say that, I'm assuming that wasn't an error of some sort, but certain things we should not take shortcuts. And in terms of an environment like a prison, I'm sure we need a certain minimal staffing level, both for the safety of the prisoners and the safety of everybody who works at the prison and the community in which it's located. So I was curious because that was the last thing I expected to see. And I'm in favor of saving money everywhere and anywhere, just as long as that thing is, somebody has an explanation for how and when that happened.
Explanation. It was a position that was created, and our labor council determined that it was not created. It was created by the prior commissioners, and our labor council determined that it was not created legally.
Okay.
Due to the fact that they did not have the authority to do it, so we removed it from the budget.
That's fine, as long as, staffing's not been impacted, you know. because, I'm sure if you ask the warden, he'd probably say the more the merrier.
In
But,
fact, the warden and I talked, it was an administrative position, which he indicated the last thing he needs there is another administrative position. So-
okay, that's fine. I was just curious because, that you just don't see that in budgets, so that stood out like a red flag, and I want to know what that was about.
As you might know, too, I mean, when you're talking about context like a prison, there are regulations that
I would
require
assume.
certain number of staff for inmates, and there's also, on top of that, there's a collective bargaining agreement.
See, that's the other thing I was curious about, because, this was a $50,000 reduction, but usually with union contracts and everything, there are certain pay raises which happen annually. So I would have expected to see some kind of increase. So, do your contracts require increases on an annual basis, or are we in a freeze right now?
That would be an answer, I think, for the Labor Council, a question for the Labor
Okay.
Council to answer, but.
But I know they're unionized.
Yeah, they are, but the correction officers are. The prison is a big undertaking.
Yeah.
So there's going to be a lot of changes with regard to the prison, which have already been started, and my fellow commissioners, to my knowledge, are in support of that. So you will see changes with regard to the prison and the staffing at the prison. It's just, we've only been here for 2 weeks.
Yeah, well, I understand that. It's just that, the prison's an entity where you don't want to cut corners unless you can verify, that there's no impact on the safety of the inmates, the safety of the staff down there, and that local neighborhood.
Right.
You
No,
know,
the position you're
so-
referring was a created position
Okay,
that
I
was
mean,
not required.
well, the budget wouldn't show that level of detail. It's just that surprised me to see any kind of salary reduction. I think the only other place, I think the only other place where I saw a reduction was in the commissioner's office, kind of thing. And there were a couple places where it went up, and I think it was like the Office of Youth and Family Services.
Right.
And that made sense of prior discussions that occurred in 2019 that they had a need, and I could understand that. But other than that, salary and wages were static across. I look at these things. See, when you're retired, you have nothing better to do. So that answers that question. And I hope that every budget year that the warden and his staff are always consulting it, as you're looking at, those line items on the prison, because, he's got to be the subject matter expert on what's happening down there. And I'm very happy to see the changes that are taking place. The GED program, how is that going, by the way?
Very good.
Warden?
GED?
We continue to run nonstop. One class starts up right after another
Yeah.
class ends.
Is it showing any impact for the inmates? I mean, are they enthusiastic?
We're running
Don't
about
care?
A little over a year now that we're running, so I don't have any statistics like how many individuals have come back,
82.5% have passed to date.
Great,
which is great.
great. Anything, to make sure they never darken those halls again. That's my philosophy. Let's see. In terms of the suicide, and I know, these things do happen. When an individual comes into the prison system, is there an intake procedure where maybe, if there's any suspicion that they might have an issue with anxiety or depression or suicidal ideation, that, we go after their medical records to see what their medical history is, what medications they take?
Actually, during my visit with Judge Brace, there is an electronic system that they're trying to get up and running, which would give the prison access electronically to the inmate's records. The inmate would have to sign a HIPAA form upon incarceration, which then would give the medical department access to their medical records to determine what medications they were on, what conditions they've been diagnosed with. So that is also in the process of being done.
If they're deemed suicide risk, can you override the HIPAA restrictions on that, or no?
What do you?
Let's say, they're considered a suicide risk and they're on suicide watch. Can you then go after their medical history, whether they agree to it or not?
We do that anyway. In the
Yeah.
newly committed individual.
So you don't have to get HIPAA permission?
We have to have the individual sign off on it to send to their.
If they won't sign off on it, what do you do?
Not much we can do at that point because of HIPAA.
But I think the warden outlined a number of evaluations that are made upon admission, and so if the individual isn't going to sign off on it, and there's a suspicion that might be an issue, then they're going to take the steps that are available to them in-house to isolate, restrain.
Yeah, I understand that, but a lot of times, you know, if you can get access to the medical records, you can see what meds they've been on.
And I appreciate that,
You know.
but that's not something that happens very easily,
Yeah.
particularly with the privacy laws.
Yeah, that's unfortunate, because you do want to zero out any risk of suicide. The only other thing I would like to ask is the school district, the city, the county level, okay, in many areas, there's a dearth of written policies, okay? And one of the things I've been curious about is I don't want any information on pending lawsuits, and I know you can't discuss that, but do we have a written policy on who gets selected to go on these various work release projects like that recycling center, which is the subject of a current lawsuit, you know, so that, you know, it's clearly written, you know, who goes, what they're paid, so to speak, where that money goes, are they given protective clothing and garments and gloves, so on and so forth. Is anything like that ever put in writing?
You want me to come up and address that?
Go ahead. But be mindful of the existence of the
I
lawsuit,
don't,
too.
I'm not asking anything about this
that's
specific
fine.
lawsuit,
I just,
but,
it'll be lengthier than just a quick
okay,
sentence, so.
Right.
and that's all I have.
We do. I'm done. No. We do. We have written policy about what I call objective and subjective criteria for placement into the programs like the community service program, work release program, et cetera. Ultimately, we rely on a judge's signature. If the individual's attorney approaches the sentencing judge and gets a signature for placement into community service or work release, great. If we are assessing an individual and we think that he could benefit from getting into work release, community service, work release, house arrest, sometimes we'll drop a letter for the judge, and then the judge will sign a court order. They don't get on these programs, community-based programs, without a court order signed by the sentencing judge.
But are there written guidelines about what they're paid per day? Are they given protective clothing?
Yes.
Things of that nature.
That goes, Joan, more to, based on my familiarity with the lawsuit, that goes to the substance of the complaint.
Okay.
So I would caution the warden not to get into that.
Yeah.
That's it,
That's
thank
it.
you.
That's it.
Anybody else?
Thank you. Bev DeBarros from Scranton. I'm a volunteer.
Bring your mic down, please, Beth. Thank you.
I'm a volunteer at our county jail. That's why I'm here. And again, welcome to the new people. And I had previously met Commissioner Chermak when he came to one or more of our prison advocate meetings to see what the job was like, what our experiences are inside the jail. So it's January, and I'll give a total of the books. One of the things we do in there, 2.5 years we've been distributing books on carts, going around to the blocks. We have a team of 10 volunteers. We go in 2 together, and for 2 hours at a time. So if we have 3 or 4 shifts a week, that's about our presence in the jail for that program. It started, like I said, 2.5 years ago when I approached the board. If I had all donated paperback books and volunteers to work on the program, could we get books in the prison? Because there was not a library at that time. And the answer was yes. And so we went with that. From the beginning, I had the help of a librarian, Anna Kilcullen, and she always came, on her own time and helped me sort the books and organize the program, and we got them in. Last year, we distributed or lent out and then got back 7,365 books to 3,808 inmates. This year, the figures are really roughly the same, and I'm sorry to say there hasn't been an increase for various reasons, but it sounds like a lot, 7,000 books, but when you consider 800 inmates, it's less than one book a month per inmate in the jail. So we can do better. We have the volunteers, we have the books, but there's a few problems that we're still working out in there. Two of the other things. So last month, in December, I asked, after these 2.5 years of book donations, which are great, I asked that we could have $1,000 for over this year from the commissary fund to really get a good base, a good variety of books instead of just having what comes in. So again, I called on Anna Kilcullen, and this was the what we came up with for our first request. And there are 38 books on here for a total of $285. And I thought, and we've talked this over, so like that would be, and then I thought again in 4 months, I would come back to the jail and ask for and submit another request, and then again in October, so that it would be like 3 chunks over the year. The first, I want to say about Anna, she couldn't be here today, but I wish she was. I asked her to put her creds on the bottom because she did the arranging of everything. And anyway, she is a master in library and informational science is her MLIS. I had to be educated on that. This was the first a proposal that she made, this spreadsheet, and compared, like, all the books that I wanted were, like, I wanted American fiction authors, and I wanted a lot about American history, like bios of Benjamin Franklin, and a lot from our good historians that we have in our country. So she checked 3 different sources. One was Amazon, and one was Abe Books, which I wasn't familiar with. But Thrift Books is what we have used as when we were using our own money, to come up with books. And they were when she compared everything, they were the best, the most reasonable, and there were no shipping charges, whereas Amazon had shipping. So that was the final proposal, which we submitted. And like I said, the total's there. So that was on January 8th, finally, that I submitted this. That same day, I think the warden emailed me back and said he turned it over to Kathy Regan, the one who would do the purchasing. And so then yesterday, he said it would be quick. And yesterday I got a call from or email from Kathy Regan, and she said it's in the works to order this first amount. So that is big. And thank you. And 4 months ago, I proposed reading glasses because I realized that there are people in there who just can't read the books. We get some large print books, but, not everything. So we know that reading glasses are available for $1 a pair at the dollar store. We asked if we could make that a part of our program. And so that was, the warden wanted it to be handled in the jail. So right off the bat, well, soon after the bat, I submitted the names of 3 people who needed them, and that was taken care of. Colleen Orzel gave them theirs. Then I submit, now this September, these 3 got theirs. After that, I submitted over the weeks 10 more people who need them, and none of those were addressed until finally I got one woman who is going into GED. She needed the strongest pair available. She got those, and she's so happy. Now I just this week we got two more names to add to the list, but somehow it's not getting from the staff to the inmates. So again, I ask, could we? I mean, we're in there. These last 2 were from Dorm C. Our team was in Dorm C yesterday. They could have just easily given this. So that's one thing I would like to ask, if we could have that in, as part of our book program.
You want to be able to distribute glasses?
Yeah, to have.
You also want to be able to acquire them.
Yeah, we're happy to buy them ourselves. $1 a pair for 20 people. I mean, we spend more than that all the time.
Warden?
That doesn't sound like a big issue. But again, my concerns were security related.
They'll have to be screened.
With donated matters, yeah.
Yeah, so how would, this issue came up in the beginning, and we know that the people can buy them in the commissary, directly from the commissary to themselves, but the same things, but they're $9 a pair that way. So is it settled? Can we do this, or
Just
what?
go through the warden to bring them in, warden?
Yeah, I was gonna say, Bev, if you can give me a call after the meeting,
Okay.
I'll figure something out.
Okay, good.
Yeah, we'll
Very
work
good.
out the screening process. That's no problem.
Okay, and just 2 comments I had on things that were brought up here today. One, oh, here we go, about the medical. Also, Commissioner, I have a women's Bible study on Thursday afternoon. That's how I first got in the prison. And there are women in there like over 2 years, almost 3 years, not just one woman, many, waiting for federal court and all that, and have not had a pap smear the whole entire time they're in there. So, and about the tablets, how does that work for indigent people? Now, I realize the people who rent a movie have to pay for it, but we have indigent people, and I was wondering if we could really get newspapers, just like you have the LexisNexis, if we could get newspaper subscriptions for free, paid for out of the commissary funds, which they've already been paid for by the inmates who have used the commissary, but they could get the daily paper. The way even before books, I have been really trying to get newspapers into the prison. But I think this is probably the best way. Again, in the beginning, we had, okay, so an inmate can subscribe to a paper, and it comes, the Times comes. Our morning paper is delivered to them at night with the mail. Then the next night, when they get the next edition, they have to return that paper. And, it's just an issue, and they're having papers and stuff. So that's fine, but that's very few people can afford to have a subscription to the newspaper. In fact, we had one donor who really couldn't afford it herself, but out of concern, I gave her the name of one person who I thought who would take this newspaper and share it among her block And so that was done for like 2 whole months or something, and it worked, but it was just too expensive. That's expensive. So this way, they could have access not to just one local paper, but, I mean, we could have 5 papers on there, as far as I understand how the tablet works, you know? So that,
An online subscription is much more cost-efficient.
yeah, and
With the tablets,
Yeah.
they can read the paper online.
Right.
On the tablet.
right. And so can an indigent person who use the tablet to read the newspapers?
That's another issue. I mean, Tim, how much would it cost an inmate to utilize a tablet, do we know? Like, do they pay a certain amount out of their commissary?
No, the tablets are free, but downloading things like movies and using it as a telephone, that would cost you money. I never thought about what Bev is describing here.
That the indigent are at a disadvantage.
In many ways, like they can't buy a pair of $9 glasses off the,
Okay, so
Thank
I'll
you.
add that to my list of inquiries.
okay. So unless anybody has a question, I'm done.
Any questions for Bev? Thanks, Bev.
Thank you.
Anybody else from the public? Okay, thank you all. Any new business from the members?
Just wanted to mention, I talked to Library Administrator Mary Garm yesterday, and I gave her Bev's contact information, and she's going to contact you, Bev, Mary Garm from the library, just to help you with an assessment of the books that are available right now, to see what else you might need over there. Okay?
Okay. Anything else? If not, I'll entertain a motion to adjourn.
So moved.
And a second? On the question? All in favor?
Aye.
We are adjourned. Thank you, Mr. Powell.